My name is Len O'Hagan and I'm chairman of the All-Ireland Congenital Heart Disease Network Board. The network came about to meet a need to provide world-class surgery and care for children on the island of Ireland with congenital heart disease problems. There was an opportunity on this small island to build a world-class service to try and maximise the excellent surgical skills that are on the island, the clinical skills and the physical assets, and combine them and to ensure that we could look after our children in the very best way. And it was an initiative that is unique in the world, in fact, because the concept is that we're going to manage, and we do manage, the patients across the whole of the island.
What the network has asked us to do, or caused us to do, is to reevaluate our entire service. So it's given us the opportunity with our colleagues in Belfast to stand back and look at what are the best elements, what would a really top-class, world-class unit be? What would it look like? It needs to be a unit that attracts people to come and work in it throughout the island of Ireland, that it attracts research, that it attracts doctors and nurses to train in the unit. And for all of that, I think we needed to have investment, and we needed to all agree on a business plan, if you like, around it. And that's what the network has allowed us to do. So far, the biggest investment is the cath lab here, where we're standing. Again, the cath lab, we needed to have a cath lab, but to get one as well equipped. This is a hybrid lab, so it allows us to do not just the traditional cardiac cath that we had done up to now, but also allows us to work with the surgeons together, so they can come and, if you like, do some of the operation here, and we can come and do our part of the operation in the same setting without moving the patient from room to room. And this is the way the world is going. It's an expensive ask. It has been an expensive ask. But I think part of the reason that we achieved that was because of the network.
Since 2015, we have been working with the structures of the network to try and establish the patient services. That has provided us with many challenges. We're trying to do something new, working across 2 jurisdictions and 2 different health services. But I think the last 2 years have delivered significant progress in terms of patient care. One of the big concerns or worries whenever cardiac surgery stopped in Belfast at the end of 2014 was how we would deal with babies and children who needed emergency or urgent care. With a lot of hard work with clinicians and managers working together, we now have an arrangement in place where all children who present to us in Belfast with needing emergency or urgent surgical care can access that care in Our Lady's Hospital Crumlin. That is a huge achievement, not just in terms of the well-being of those children, but also in terms of alleviating the stress on the families of those children. Particularly for mothers who've just delivered their baby, it means that they don't have to fly out of the country to access treatment. Probably the biggest success in terms of working together, I think, has been the establishment of the Paediatric Cardiac Catheterisation Programme for Northern Ireland patients in Dublin. The way that works is that our paediatric cardiologist, Dr. Brian McCrossan, together with consultant anaesthetist Stephen Robinson, look after those patients, do the procedures in Dublin, and the patients have a 48-hour stay at Our Lady's Hospital Crumlin. That has meant that those doctors have also worked with the support of colleagues in Dublin of all grades of staff, and have achieved something that's, I think, quite remarkable and has made a big difference to the lives of many families over the past couple of years. And just, I suppose, in a network, traffic should be in both directions. And finally, during this current year, we have had adolescents who have been on waiting lists in the Republic of Ireland come to Belfast to have treatment of their arrhythmias by a procedure called radiofrequency ablation under the care of Dr. Conor McCann, and that has helped alleviate that problem of a waiting list in the Republic of Ireland.
So in Belfast, Charlie, from he was born, has received excellent treatment in Belfast. He has a fantastic team here of cardiologists. His own consultant, Dr. Casey, has been fantastic throughout his care. The treatment we've received in Dublin has also been very good, and it almost flows with Belfast as well, because there's such good communication between Belfast and Dublin. And for Charlie's last catheterisation there, it was actually Dr. McCrossan, who has been doing Charlie's catheterisations in Belfast, travelled to Dublin to do the catheterisation in Dublin. So it was very good just to have that continuity of care for Charlie and for ourselves as well. When Charlie first went down as an emergency to Dublin, the network was there, but I can see now over the years, that was maybe 3 years ago, and I can see now over the years that is really building. I think we're very lucky to have the Belfast to Dublin network here on the island of Ireland.
The Paediatric Cardiac Surgery Network has excellent input for all of the children on the island. Looking at it from the perspective of a paediatric cardiac surgeon, I can see the benefits in terms of surgical volumes within the unit, which helps maintain the expertise of all of the staff involved, whether it's nursing, paramedical, anaesthesia, surgery. It also means that families have one focus where they can attend for all of their treatment. They know where that is. It's easily accessible no matter where you're coming from on the island.
From a nursing perspective, the aim of the network is about our patients. It's about us giving the best care that we can to the cardiac population from one end of the country to the other. That's very important to us. So the network for nursing sees huge opportunity for us to collaborate with each other. I think the future is very bright for nursing within the network. We have a fabulous team here. I know that Belfast have a fabulous team in their centre as well, and there's so much opportunity for us to share in terms of our practice.
I'm Michelle. What's your name?
Lacey.
Lacey.
I'm Lee.
Lacey's waiting for a heart transplant. She's been diagnosed with dilated cardiomyopathy. So we're just waiting to get the call for the organ donor. Yeah. Well, Crumlin has become home from home for us, really. We have been here, as I said, since August. Back in February, Lacey had a CATs done in the new lab, and the care we got from the time she went down to the lab, and the reassurance, and even coming back and everybody's wheeling her back and everybody's smiling and reassuring us that she was okay. It means a lot to her family, I suppose, when their child has got down for a CAT. The nurses are just like our family, as we call them. They're so compassionate when it comes to the patients and the families, and they understand your journey. I think even though it's not them living it, but they understand as a family what you're going through, and they sympathise with you and would always kind of ask how you are, and if you're having a bad day, they'll always reassure you that everything is going to be okay. We're in the best place, and we just have to wait for a donor to come, don't we?
We're very fortunate that within the two teams in Belfast and Dublin, we have many young talented people who can drive the network forward over the coming years. I think that what we owe it to them is to give them the opportunity to build a service that they can be proud of, and most of all deliver the very best outcomes for the families that we all treat.
The network is well on the way to achieving its vision of a world-class family-centric congenital heart disease service for the island of Ireland. We've started very well. The introduction of professorships and research is so important. That will increase the expertise available on the island, will attract more people, clinicians and nurses, to want to work in this very important area. We do, of course, require the continual support of the departments from both sides of the border and the ministers from both sets of governments. And I think that finally that it is the support of the families and the belief of the families and the families supporting the network that will really make it embedded into the medical system on both islands.